Cumberland County Mental Health Center provides a helpline 24 hours a day, 7 days a week. Belinda Davis, Director of Screening, Triage and Referral, tells us how individuals and families who are experiencing challenges associated with mental illness, emotional problems, developmental disabilities, or substance abuse can access mental health services in our county.
Screening, Triage and Referral is a department within the local management entity which came about with mental health reform a few years back. And each local management entity, or LME as it's affectionately known, has a screening triage unit that is essentially the hub, we think of, to receive calls or visits from folks who are seeking services which have to do with mental health, developmental disabilities, as well as substance abuse. Sometimes it's a general question about what might be available in the area. Sometimes a person does present with a specific need, and our access specialist will take down information and gather certain presenting factors, so to speak, that will help us assist that person in determining what type of service they may actually need to be referred for. Anyone can call our 24-hour-a-day line. There's a number that's available on the screen for folks to reach us through, and they will reach a live person who will talk with them and try to assist them in whatever way they may need assistance at that time. We do prefer that a parent or guardian telephone on behalf of a minor, or if a person is an adult and has a guardian, it is a lot easier to speak with that individual and get the necessary consent to make the referral. Some individuals may have insurance, whether that be Medicaid or a commercial type insurance that can cover whatever type service they're going to need. But there is also a program that the state has set up which provides money to fund for those folks who do not have insurance but need the services. We have a cross-training as such with both substance abuse, developmental disability, and mental health, and across the ages as well. And we have several folks in our department who have also had years of experience across all populations and age groups. We receive everything from an informational call. We may actually get a call from someone who's seeking a medical doctor, and we're able to help them find direction whether that be through the phone book or some other access numbers that they might be able to find the medical care they need. We have that. We have folks who are seeking all types of support groups, perhaps anger management group. Recently divorced individuals might seek a group. That is generally what we would call a community resource. But we also have folks who are looking for court-ordered services. Sometimes through the juvenile system, there will be referrals made for both children, but as well, maybe the parents are needing some type of assistance, parenting assessments, parenting classes. Then we have calls for basic services. Perhaps a person's dealing with situational problem that they need to get in to see someone to talk, what people used to call kind of talk therapy, where they just need to talk out some things. But we also have folks who call in serious crisis. We have a fair number of folks call that may not have a definite plan to harm themselves, but are just in distress and need someone to come to them. And we have available in the community what's called mobile crisis. And it is a team. However, that does not mean that there's going to be a whole team full of people go out. It consists of a team where they can consult with one another about what might best meet the need of an individual they're seeing. And we also occasionally have folks call who are in such severe crisis they are thinking of harming themselves. Have had occasion someone says, I might harm someone else, and we will make a 911 call. We remain on the phone with that individual until the emergency personnel arrive. We like to think of ourselves as being a safe harbor for anyone who may have a question, a concern, either for themselves, a loved one, a friend, that needs someone who cares to listen. You know, not everyone needs to have a referral out to a counseling center, but they may need someone right that moment to be with them in that moment, to help them be more reassured that there is help available for them. And if it's like I find myself at times, it's just good to talk to someone, and that's what we're here for.